I'm going to review the status of our COVID-19 pandemic here in King County, talk about the updated boosters and recommendations, a little bit about flu season and flu vaccines, and a quick update on monkeypox outbreak. But I first need to start with a disclaimer. We in Washington State are having some reporting problems with two very important data systems that are affecting our counts this week. And so we're getting an artificially low number of reports of cases and hospitalizations. And these are due to two of our important systems. One's our electronic lab reporting system. The other is what's called the Rhino system. And our colleagues at the Department of Health are working on workaround solutions to get those data back as quickly as possible. But what you currently see on our dashboard is not accurate, and we're going to be putting up a statement about that and taking that inaccurate information down until we can get it more complete. And for this reason, I'm going to be referring to our data from the week of October 5th, which is the last full week of complete data that we have. So with that, by way of introduction, I want to tell folks that our Omicron BA2 and BA5 wave peaked over the summer, with hospitalizations decreasing from mid-July through August, but they've plateaued at about 10 to 13 hospitalizations a day for the past 6 weeks or so. Over the past month, reported COVID-19 activity has decreased among all age groups, and we are still classified in CDC's low community level, low COVID community level, while our COVID transmission rate, which is based on reported cases, remains high, just above the cutoff separating high transmission from the substantial category. And it's important to remember that reported cases reflect primarily PCR results and do not include at-home tests. And therefore, it's a significant undercount of the number of cases that are actually occurring. Although COVID activity has been trending down, if we account for underreporting, there are still thousands of new cases and many thousands more with infectious COVID-19 in King County every day. Now, our hospitalization rates have decreased by almost 50% from our recent peak in mid-July. Yet, over the last week of September, 89 people were hospitalized for COVID-19 in King County, which is a hospitalization every 1 hour and 53 minutes. And despite the decrease in hospitalizations and cases, for most of the summer, deaths have remained relatively stable at 2 to 4 deaths per day. Over the past 14 days, deaths have trended down to about 2 average deaths due to COVID-19 each day. So to put this number of deaths in perspective, if these recent levels are sustained, about 2 deaths per day, COVID-19 would be the 5th leading cause of death annually in King County, more than unintentional injuries, stroke, diabetes, or influenza and pneumonia deaths. And we know that 82% of our hospitalizations in the past 30 days were among people greater than 50 years of age, and 91% of deaths are among people who are greater than 60 years of age and older. 5% were among people under 20. So the vast majority of hospitalizations and deaths are in adults, and particularly adults over 50 for hospitalizations and over 60 and greater for deaths. Yet despite this risk, only 29% of eligible adults 65 and older have received the new updated booster. And the rate is about half of that for 35 to 64-year-old adults, and is 8% in 12 to 35-year-olds. And we'll talk more about the booster and booster coverage rates in a few minutes. In addition, long COVID is a significant and growing health burden for our community, for our workforce, and for our economy. Even if the rate of long COVID is only 5%, there are likely tens of thousands to over 100,000 people affected by long COVID in King County. This interferes with people's quality of life, with their work, with their schooling. Now, we know vaccinations decrease, but at this time, don't eliminate the risk for developing long COVID. And it's another reason why we need to think about multiple layered COVID prevention strategies. Now, let me share a little bit more about booster doses. The updated booster, which is also referred to as the bivalent booster, is specially targeted to the COVID-19 variants that are circulating today. The updated boosters will provide the best possible protection we can get from COVID-related hospitalization and death. This is especially important for people who have underlying health conditions and for adults who are 50 and older. Getting all recommended booster doses is especially important for these groups. It's also very important for people who have weakened immune systems, who are pregnant, and have one of a number of common underlying health conditions. Vaccination, as I said, can also lower the risk of long COVID, which can lead to serious health problems that can prevent people from working and doing other activities that are important to them. Now, if a large number of people don't get the updated booster, especially adults at increased risk because of age or underlying conditions, we may see a large number of preventable serious health consequences from COVID-19 this fall and winter. This includes severe COVID-19 causing hospitalizations and deaths, preventable cases of long COVID, and stress on our healthcare system, leading to additional adverse health consequences for individuals in our community who need to seek healthcare for COVID or any other reason. A recent study from the Commonwealth Fund found that a fall COVID-19 updated booster campaign that reached 2020-2021 influenza vaccine coverage levels would save 75,000 lives and prevent 750,000 hospitalizations in the US. And it would save over $40 billion in medical costs. That is if we could achieve the level of COVID booster, updated COVID booster dose coverage equivalent to what we see for influenza. On the other hand, if we don't have adequate booster coverage, we could suffer many preventable infections, hospitalizations, and deaths during a wintertime COVID surge. So let me share a little bit about our booster vaccination coverage. As you may know, overall, King County residents have some of the highest rates of COVID-19 vaccination in the country, with 87% of people 5 years of older and over 90% of those 35 years and older having completed their primary series, and that's outstanding. On the other hand, as of Wednesday, October 12th, 218,000 residents in King County have received an updated booster. Thank you for those people who've come forward. But there are still 29% of eligible adults who are 65 and older, and 14% of the total eligible population who have received their updated booster. So again, only 29% of eligible adults 65 and older have received their updated booster. And again, this is the group that is at highest risk for hospitalization and death. We really need to get that number up if we're going to keep people out of the hospital and keep them alive during a fall winter surge. Now, clearly the number of King County residents who received the booster is much lower than what we need to protect ourselves as individuals and as a community during the coming fall and winter wave. And this is particularly concerning because during the months with colder weather, people spend more time indoors. That provides a better environment for viruses to spread, including COVID-19, influenza, respiratory syncytial virus or RSV, and other respiratory viruses. Now, a recent survey by the Kaiser Family Foundation found that almost half of adults surveyed in the US don't realize that they're eligible for the updated booster vaccine. And I just want to clarify that anyone who is 5 years of age or older who has gotten their last COVID shot at least 2 months ago is eligible and should get their new updated booster shot. It is the single most important way to avoid serious COVID infections this fall and winter. We're doing outreach to continue to try and promote updated booster doses and make them accessible in the community. We have a number of strategies that we're using, including providing access points at community vaccination clinics. And our Auburn vaccination site at the Outlet Collection Mall is offering updated booster doses, and we'll take drop-in or walk-in appointments. Eastgate Public Health is also providing the vaccine. We also continue to coordinate vaccination access points in the community with a particular focus on reaching Black, Indigenous, and other communities of color that have suffered a disproportionate burden of COVID-19 cases, hospitalizations, and deaths. For example, our community partnerships have been key in helping us connect communities with vaccine. And this work is continuing, including by our community navigators. And we're going to put two recent short videos in the chat that describe some of these efforts in more detail and the great work of our community navigators that I'm very proud of. For example, there are 12 different access points scheduled in the next couple of weeks in partnership with libraries, community organizations, faith-based organizations, and senior centers. And you can see a list of these sites on our Getting Vaccinated page. We'll also put a link to that page in the chat. All of these sites will have the updated booster shot available. We also have mobile vaccination teams that are providing older and disabled adults with updated booster shots at senior centers and senior housing locations that include the Seattle Housing Authority and King County Housing Authority sites. We also send our mobile teams to vaccinate residents and staff at long-term care facilities, including adult family homes, and as a backup to services provided by pharmacies, who are the main immunizers at long-term care facilities. We continue to provide in-home vaccination at private residences for people who are homebound and their caregivers, and our Healthcare for the Homeless mobile vaccination team is providing COVID and flu vaccines at homeless service sites and permanent supportive housing locations. We also know that schools are an important access point for children and families. Nearly a year ago, approximately 30,000 children received their first dose of COVID-19 vaccine at over 200 school-based clinics in partnership with 18 school districts. We're working with some districts now, including Renton, Tukwila, and Seattle Public Schools, to coordinate COVID-19 booster clinics in the upcoming weeks. Seattle and Renton will be holding weekend COVID and flu clinics into October and November. And these are open to students, families, and members of the general public. And more information and registration options for these weekend clinics can be found on the school district websites. And we'll put links to those sites in the chat as well. And we've definitely heard that some people are having trouble making convenient booster shot appointments, and that's not a good thing. I'm not happy about that. I understand the frustration involved in trying to schedule an appointment that is not easy and is time consuming and is something that you want to do now. Unfortunately, due to lack of new COVID-19 funding from Congress, a number of community vaccination sites have been forced to either close or reduce their hours of operation. In addition, many of our pharmacies and clinics are reporting staffing shortages that impact the number of available appointments that they can accommodate each day. Now, there was a booster supply shortage initially after it was first authorized, but in the last 2 weeks, our providers in King County have been receiving 100% of the doses that they order from the state. So there's not a vaccine shortage, but there is a constraint related to the number of people that we have in the community that are able to deliver vaccines due to staffing shortages and federal inaction on providing COVID-19 funding. So if folks are having trouble finding appointments at their healthcare provider or their local pharmacy, please check out our Auburn and Eastgate public health vaccination sites. They're free, they're open to everyone, they take walk-ins. You can get more information about this at kingcounty.gov/vaccine. I understand the frustration. I'm sorry it's occurring, but I can assure you that it's worth the effort to persist and get vaccinated with an updated booster. Now, just yesterday, the updated booster was also authorized for children 5 years of age and older, and we encourage everyone to get their children vaccinated to help prevent COVID-19, prevent long COVID, and even children are susceptible to long COVID as well as other complications like multi-system inflammatory disease, MIS-C. So we anticipate that our healthcare providers, community clinics, pediatricians, and others that immunize kids will be able to offer this updated booster soon. It's not clear yet to us which pharmacies will be immunizing younger kids, but you can call and find out, particularly if your pharmacy is more convenient than your healthcare provider for getting vaccinated. Again, our sites at the Auburn Outlet Mall and Eastgate Public Health Center will be offering updated boosters, including for children 5 and older, beginning the weekend of October 21st. And again, drop-in appointments are welcome. So quick pivot to influenza and some advice around the flu shots. In a typical year in the US, there are millions of influenza illnesses and doctor visits, as well as hundreds of thousands of hospitalizations and between 12 and 52,000 deaths. And this actually represents an undercount of influenza-associated deaths because many people who die from influenza-related complications aren't tested for influenza. In King County, based on the national data, we would expect between 80 deaths per season in a mild season to about 400 deaths per season or more in a severe season. And although this is also likely an underestimate, these are serious numbers. Now, although we can't know in advance when an influenza season will take off or peak or how long it will last, it's a safe bet to expect that this flu season will be more severe than the past two, based on what's happened in the Southern Hemisphere this past flu season that they experienced. In our area, flu typically starts to take off in November and December and lasts through spring, but some years it does arrive earlier. So far, influenza activity is low, and it appears to be increasing over the past 2 weeks, and we'll have to wait and see if that's sustained and how much of an increase that represents. But it is low level but present, and that means that it's a good time now to start getting vaccinated. And particularly now through early to mid-November is generally good timing in our area. But the key is to be sure you get your flu vaccine before the flu hits. And if you're not going to be able to closely track flu activity locally, which you can do based on our flu surveillance website, it's best for you to just get your shot between now and Halloween. That would be good advice if it's a now or never situation. If you can track and you're interested in trying to fine tune that timing and waiting a little bit longer to perhaps improve the duration of protection you would get, then you can do that. You can wait and see what happens over the next couple of weeks. And when activity starts to tick up more meaningfully, you can get vaccinated. But it's important to remember that it takes a couple of weeks after the vaccine for the protection to kick in. So if you're not the type of person who's going to be able to closely track flu activity, this is the time to get vaccinated. And if you want to track it, it's reasonable to wait until later into November. Now, monkeypox. Let me just give a very brief update. Cases in King County, as they have nationally, have leveled off. And we were seeing over the summer 60 cases a week or so. More recently, we're seeing about 10 cases or even fewer per week. Most people who are contracting monkeypox are men who report sexual contact during their exposure period. Vaccine is much more available than it was during the initial weeks of the outbreak, and getting vaccinated before being exposed to monkeypox provides the best possible chance to prevent monkeypox disease. So we strongly encourage people who are at risk for monkeypox to continue to take advantage of the vaccine. For the best protection, 2 doses of the Jynneos vaccine spaced 28 days or more apart are recommended. And because we have more vaccine relative to demand, we are able to expand vaccine eligibility to more people who are at risk. So now the following risk groups are eligible: individuals who've had skin-to-skin or other close contact with someone with monkeypox, men or transgender individuals who have sex with men or other transgender individuals, individuals of any gender or sexual orientation who engage in commercial and/or transactional sex. And we can put a link to those eligibility criteria in the chat for you. We are not recommending vaccination for members of the general public who are not at high risk of exposure to monkeypox and who have not been experiencing a monkeypox outbreak as the high risk groups have been. And again, you can find more information about monkeypox and vaccine on our monkeypox vaccination website. And with that, I'll pause and take a sip of water and then take your questions.
Great. Thank you so much, Dr. Duchin. As a reminder for media, if you have a question for Dr. Duchin, please use the raise your hand function in Zoom, and we'll take a question from Kate Walters with KUOW. Kate, go ahead.
Hi, thanks so much for doing this, Dr. Duchin. We really appreciate the updates. You mentioned a whole host of programs that are set up and that have been running throughout the pandemic to help people get vaccinated, increase access, things like that. Even with these programs running, we're not seeing a really high level of uptake of this updated booster. And I'm just wondering, at what point do we need to try something different, or are there any kinds of plans in the works to try to come at this from maybe a different angle or increase access in different ways?
Yeah, thanks, Kate. Very important question about booster uptake. So a couple of things come to mind. We are still relatively early in, the availability of this new booster, and we understand that people have a bit of booster fatigue. Have been a number of boosters recommended for the reason that protection against hospitalization and death does decrease over time, and boosters restore that protection. And for example, we know that the fourth booster after the third provided a significant amount of increased protection compared with not getting that fourth booster. So the boosters clearly help, but people are, as the Kaiser Family Foundation survey demonstrated, a little bit fatigued and confused about whether they're eligible. So one of the key things you want to do is to educate people about their eligibility. Basically, anyone who has not had a new updated booster and has had their last shot, COVID-19 vaccination at least 2 months ago, is eligible. And in addition to that, emphasizing the importance, the protection that is needed now and will be needed going into the fall and winter. And I'll say a little bit more about that in a few minutes, but I think there's a very significant likelihood that we're going to have a very bumpy ride this winter with increased COVID transmission and risk of a high number of hospitalizations and deaths that could be prevented. So more public messaging, clarification of who's eligible, I think, are going to be really important. Working with our healthcare partners to reach out to patients who are eligible and recall them. And this is another recommended strategy, although unfortunately, as you know, our healthcare systems are feeling quite fragile and stressed right now due to staffing shortages and don't have the robust capacity to put on many of them don't have the robust capacity to put on large scale clinics, and we haven't received funding from the federal government to allow that. So that's a challenge, but it's definitely something we're asking people to do to promote when patients come in who are eligible, to promote the vaccination and vaccinate, and to recall patients who are eligible, beginning, of course, with the highest risk, those 65 and older, 50 and older, any of the number of very common underlying health conditions, diabetes, chronic liver disease, pulmonary disease, cardiac disease, metabolic disease. Even obesity and overweight can be risk factors for complicated COVID, pregnancy, immunosuppression. All these people, should be vaccinated as soon as possible, and preferentially, by the end of this month. There are healthcare systems that are requiring booster vaccination coverage or declination of booster vaccine for their employees, but mandates are not being considered, as far as I know, in other settings.
Great, thank you. Next question is from Ryan Harris with Northwest News Radio. Go ahead, Ryan.
Hi, thanks, Dr. Duchin, for taking my question. You've touched a couple of times on the possibility of things getting pretty ugly with COVID again this winter, cases going up on the rise. I'm sure the exacerbated flu season won't help with that. But considering how many people are vaccinated and those who do have boosters, are we pretty much past the days of considering going back to like mask mandates or other restrictions? Because you also mentioned layered protections needed.
Yeah, really appreciate that question, Brian. We are absolutely concerned about a severe fall-winter surge, and I'm going to say more about that in a few minutes. And we know that protection from past infection and from past vaccination wanes over time. So we are increasingly vulnerable every day that people do not get boosted. In addition, there are other threats out there like new variants that appear to be able to evade immunity. And we don't really know yet what they're going to contribute. And again, I'm going to say a little bit more about that in a couple of minutes to answer several of the points of your question. I do think that it's very important for people to understand that we can't rely on vaccines alone. We need a vaccines plus strategy. And that means that vaccines in combination with improving indoor air, this is one of the most critical steps that we can take to decrease the risk for COVID-19, as well as transmission of other respiratory viruses in indoor environments. So improving indoor air quality, wearing high quality like N95, KN95, KF94 masks in indoor crowded settings, testing when people have symptoms and isolation when you're ill. All of these are really important layers that are necessary to meet the ongoing challenge that this relentless virus is posing to us at this point and prevent as many cases as possible, as many hospitalizations as possible, as many cases of long COVID as possible. So I think all of these things remain really important. And, to the extent that the public would accept mandates and vaccines, I think mandates and requirements around vaccines or masking, I think that's gone down tremendously. And I think there's good reason for that, right? I mean, our healthcare system currently is functional. It's not being overwhelmed like it was early in the pandemic. And there's been a very clear message from political leadership from the highest levels of government that those days are past. Now, should something unexpected happen, I wouldn't say anything is off the table. I mean, we need to do what we need to do to protect our community's health and our healthcare system's viability. But at this point, based on where we are today, I would say that mandates per se are not being considered and aren't needed at the moment. But we do need compliance. We need voluntary compliance. We need people to do whatever they can to encourage voluntary compliance so that people can take the steps and feel comfortable taking the steps that are necessary to protect themselves and protect others. So for example, you heard recently that CDC authorized healthcare facilities, or shouldn't say authorized, but changed their guidance for healthcare facilities around universal masking in areas of the country where COVID transmission rates are no longer high, so that they wouldn't necessarily have to have all their healthcare workers masked for any patient encounter. And there was tremendous pushback against that. It doesn't make any sense, when you're going into a season where you expect to see a surge in cases and where there's so many people who are not optimally protected through vaccination, where vulnerable people are gathering. And, for example, the Association of Professionals in Infection Control provided a very strong statement articulating why that's not a good idea. So, we need to have people understanding what is a good idea, how to protect themselves, how to prevent spread to others to the greatest extent possible, and making, I think, more sustained efforts to improve those behaviors like indoor air, masking when transmission is high, making sure we have availability of testing and so on. So I'll touch on some of the other points that you raised in a sec, but the bottom line answer is at this point, no, outside of the healthcare setting, mandates are not being considered. But as with all else around COVID, the virus is unpredictable. And, I'm hoping we would never get to the place where, that type of thing would be necessary again.
Thank you. Next question is from Elise Takahama with Seattle Times. Elise, go ahead.
Hi, Dr. Duchin and Kate. Thanks so much for all the info. I think you actually might touch on this a little bit later, in which case we can move to that portion. But I was just going to ask about, in regards to current COVID levels, is the state and county still tracking the circulating variants? And are there any new ones that are starting to show up in what new cases there are out there?
Sure, Elise. Thanks for the question. Yeah, the State Public Health Lab does track variants. They put out a variant report, and the federal, the CDC is tracking and reporting on variants circulating. There are at least 30 variants that the World Health Organization is currently monitoring. They're almost all, if not all, descendants of Omicron, which is good because our updated booster vaccine is an Omicron descendant focused on protecting against both the original virus and the BA.4/5. And early data from laboratory studies show that it has broad protection against other variants as well. And we're hoping that pans out. We won't know, of course, until we have experience with new variants. And people can be tracked and see how well the vaccine protects. But it's anticipated, and the point of it is that we think it's going to give good protection, but not perfect. The vaccines aren't perfect, and that's why we need the other strategies. Nonetheless, yes, we're tracking, and up until recently, BA.4/5 were responsible for almost all the cases, in the U.S. and locally, and over the last couple of weeks, that started to change, and some of the newer variants are appearing, however, not in any large numbers yet. And I will talk a little bit about what's going on in Europe, which usually is a harbinger of what's can be expected here in the US. But yes, we're tracking. We're still firmly in the BA.4/5 era, and we, at this point, we don't have an indication of which of the many potential contenders out there among the new variants may become prevalent over the next couple of months. But, I believe that BA.4/5 certainly will be replaced by another variant that has more immune evasion. And what the health consequences of that will be, are unclear at this point, but they could be worrisome for sure. They're certainly not going to be good, and we need to be prepared.
Great, thank you. I'm going to take one question from community members watching on Facebook. So prior to the release of the updated bivalent boosters, there was recommendation from CDC that older adults and people with underlying conditions get multiple booster shots. Now that the updated bivalent booster has been released, what is the guidance around that? Should certain groups consider getting multiple updated booster shots?
Yeah, thank you. The new policy is simpler. If you have not received the new updated bivalent booster, and it's been 2 months or more since your last dose, you're eligible for that updated new bivalent booster, and that's all you're recommended to receive at this time. So, the recommendations for third booster, fourth booster are no longer in effect. The recommendation for everyone is the new updated booster if you haven't yet received it and you're eligible, and it's been at least 2 months. And once you receive that, you are now up to date with the current guidance. You've got the best possible protection against the variants that we expect to be circulating and the variants that are circulating today. And if additional boosters need to be recommended in the future, they will be, but you will not have to worry about, third booster, fourth booster at this point. It's just the updated booster. If you haven't received it, it's a really good idea. Decrease the risk for adult hospitalization and death, prevent illness, prevent long COVID to the best extent we can.
Great, thank you so much. That is it for questions. So Dr. Duchin, I'll hand it to you for some closing remarks.
Well, thanks. I want to hit upon a few points that some of our media colleagues raised in my closing points. COVID activity has decreased over the past month, although we continue to experience a substantial number of cases, hospitalizations, and deaths. For example, in King County, the current levels of hospitalizations and deaths going into the fall-winter season are higher than they were before each of the prior COVID-19 surges. And we're already seeing increasing COVID-19 activity and hospitalizations in many European countries, even before any of the new variants have become dominant. So this is an important point. We're seeing significant numbers of cases and hospitalizations in multiple countries in Europe, even before a new variant has entered the picture. So this means that, the waning immunity, the increasing gathering, the return to pre-COVID activity is leading to a surge in COVID in Europe. Now, this should be a clear warning for us, because in the past, major surges in Europe have been a good predictor of what we can expect to see in the US in about 4 to 6 weeks. So with waning immunity from past infection and vaccination, with increasing activity in indoor gatherings in the fall and winter, and people returning to their pre-COVID lifestyles, with other environmental changes that promote COVID-19 spread, such as decreased temperature and humidity, and a bucket full of worrisome new variants on the horizon, with low booster rates, especially in our older adults, we remain vulnerable to what could be a significant fall and winter surge. And there's a real possibility we are now in what will turn out to be the lull before the storm. Even current levels of COVID-19 in combination with the return of a typical moderate or severe flu or RSV season would lead to severe stress on our healthcare systems, with consequences for anyone needing to access healthcare for any reason. When our healthcare system is stressed, it hurts all of us. Now, vaccines are the foundation for individual and community protection from COVID-19. The single most important step we can take to protect ourselves and our community is to get vaccinated if you're not vaccinated, or if you've been vaccinated and your last dose was 2 or more months ago, get an updated booster soon. But it's also important to know that vaccines alone are not sufficient. We need a vaccines plus strategy with attention to improving indoor air through improvements in ventilation, filtration, and UV technology where appropriate, the use of high quality masks like N95 and KN95 and KF94 in indoor public spaces, avoiding indoor crowding when possible, testing if symptoms develop, and retesting in a few days if negative, because it can take up to 5 days after symptom onset to be positive if you've been previously infected or if you've been vaccinated. And isolating when ill and seeking treatment promptly if you're eligible. The bottom line is we need to be prepared for what seems to be an increasingly likely possibility of a significant surge in COVID-19 activity this fall and winter. And we need to understand the need for multiple, sustained, layered strategies to prevent COVID-19 to the greatest extent possible. Thank you again for joining us today, and I look forward to talking with you again in a few weeks.
Thank you so much, Dr. Duchin, and thank you again to everyone who joined from the media and watching live on Facebook. You can follow along with our work at publichealthinsider.com. Thank you.